Health workers in Nigeria are calling for a reform in the health sector, as about 78.1% of health workers are said to be burnt out. The call was made by resident doctors in the Federal Medical Center, Abuja, during their 7th annual general meeting and scientific conference themed Burnout Among Doctors, Current Reality, Challenges and the Way Forward. Correspondent Lois Abba-Sambo has the details.
The mass exodus of Nigerian health workers to greener pastures is no longer news, as this is causing a great burnout amongst the few health workers left in the country. However, in the midst of this, the Association of Resident Doctors FMC Abuja chapter at its annual general meeting and scientific conference discussed their current realities and the way forward, led by the medical director, Professor Saad Ahmed.
Being a doctor or a physician alone is enough for you to have burnout, because daily your job schedule is quite tight. You deal with sick people, you deal with dying people, and all of that. The CEOs will always advocate for improved conditions of service, salary and welfare schemes. And as we all know, we are having shortage of manpower because of that. And why do people leave? Most of it, I can tell you, is monetary. You can't expect to see someone here maybe collecting 100,000 when you can only take a flight 4 or 5 hours, and then he'll be collecting maybe 3 to 5 million naira equivalent.
Burnout in the Nigerian health sector has been explored by Nwosu et al. And they found out that up to 78.1% of physicians and nurses were burnt out. The concept of burnout includes increased mental distance from one's job, feeling of negativism, cynicism, inefficiency, and exhaustion.
Speaking to ASO Radio and Television, President of the Association of Resident Doctors FMC Abuja, Dr. Adebiyi Olusegun, highlighted the impact of burnout and mass exodus of health workers on the Nigerian healthcare system.
Burnout is dangerous. Burnout is as dangerous as the illnesses or the diseases patients come to the hospital with. And the burnout is even worse for us now because a lot of our colleagues are leaving the country. It's like in a department where you had maybe 15 people. 7 people have left the department. So the work of 15 people is now being done by 8 people. So how the government can help us with this is to help ensure we employ more healthcare workers.
Other doctors share their experiences and how it affects their mental health and productivity.
For me, after a very busy call, I'm usually very tired and concentrating is poor. And what I do for myself, when I see I'm in that situation, I just log off and get somebody else to see the patient. So for that reason, it affects productivity, which means the total number of doctors to see patients should be reduced with 1.
Personally, burnout has affected many doctors, myself inclusive, from the working hours, particularly when a doctor is on call, like a weekend call when you work for 24 hours and then a Monday comes after that and you have to work from 8 to 4. Personally, I'm not thinking of traveling out to work anytime soon, but like relocating to another country, no. I feel I'm much needed here, and then I have this satisfaction of working here.
With a high rate of burnout amongst healthcare workers, it is important that their mental health is given priority to avoid a total breakdown. Lois Abba-Sambo, ASO Television News.